Hi friends, welcome back to Pain Policy Practice. In this series on living with chronic pain, we've been discussing several important topics such as daily strategies, mental health, and chronic pain, navigating the healthcare system. So today let's focus on another important topic, patient expectations versus medical reality. When people live with chronic pain, they often hope for clear answers and complete relief. But the medical reality of chronic pain treatment can be very complex. In this video, we'll explore why that gap exists and how it affects the patient-doctor relationship, and how better understanding on both sides can improve care and communication. This conversation is not about blaming patients or defending physicians. It's about understanding the gap that often exists between what patients hope for and what medicine can realistically deliver. Closing that gap can improve communication, reduce frustration, and ultimately lead to better care. So why do expectations matter? When people develop chronic pain, they often enter the healthcare system with expectations shaped by prior experiences. So if you remember, most of us grew up with a simple model of medicine. You have a problem, you see a doctor, the doctor diagnoses it, you receive treatment, and the problem goes away. Now that model works very well for many acute conditions. For example, an infection treated with antibiotics, or a fracture treated with a cast or surgery, or a surgical problem that can be repaired. But chronic pain often behaves differently. There are multiple contributing factors which require long-term management. Improvement may only be partial rather than complete in many acute cases. And when expectations are based on an acute care model, patients may feel confused or disappointed when the process becomes longer, slower, and more complex. So what's the reality of chronic pain? One of the biggest realities in chronic pain care is complexity. The pain mechanism may not be fully understood, and imaging findings do not always match symptoms. Treatments often provide partial improvement rather than a complete cure, and progress can take time. At the same time, physicians must carefully weigh benefits against potential risks when recommending therapies. Chronic pain is not simply pain that lasts longer. In many cases, it involves changes within the nervous system itself. Pain signals can become amplified. The brain and spinal cord may process signals differently. Pain can become influenced by sleep quality, stress, mood, physical conditioning, and environmental factors. So because of this complexity, chronic pain rarely has a single solution. Instead, treatment often involves management strategies rather than one-time cure. And that difference is where expectations can begin to diverge from reality. So common patient expectations. Many patients understandably hope for a clear diagnosis, a definitive treatment, and rapid relief. Patients may expect that imaging like MRI scans or CT scans will identify the exact cause of pain. They may even expect that a procedure or a medication will eliminate the pain entirely. And they may expect that if pain persists, a stronger treatment must exist somewhere. These expectations are completely reasonable. Pain affects quality of life, work, relationships, sleep, and emotional well-being. It is natural for people to want complete relief, but medicine does not always have that option available. Medical reality in clinical practice is where pain specialists often approach chronic pain differently. Instead of asking only, how do we eliminate pain, they may ask, how do we improve functional safely? Treatment plans often focus on improving mobility, reducing pain intensity, improving sleep, increasing daily activity, reducing risk from medications. Many therapies work incrementally. Physical therapy may improve function over months. Medication adjustments may require careful monitoring. Procedures may reduce pain partially rather than eliminate it completely. So these outcomes may still represent meaningful improvement even if they fall short of a complete cure. Often I am asked by patients the all-important medication question, Doc, can you prescribe a stronger medication? Some patients assume that if pain remains severe, stronger medications should be prescribed. But physicians must consider many factors like long-term effectiveness, side effects, drug interactions, dependency risks, regulatory oversight, and so forth. Certain medications, including opioids, can provide benefit in specific situations, but they also carry significant risks when used long-term. Modern pain management therefore emphasizes multimodal treatment, which may include physical therapy, behavioral strategies, interventional procedures, sleep management, and medication optimization. Chronic pain is best managed with multiple approaches. The goal is balance between relief and safety. So why do misunderstandings occur? When expectations and medical realities differ, communication can break down. Patients may feel dismissed, disbelieved, or labeled. Clinicians may feel constrained by evidence, concerned about safety, or limited by regulations and insurance rules. So without context, these differences can create frustration on both sides of the exam room. But often the underlying issue is not disagreement about suffering. It is disagreement about what medicine can realistically achieve. So how can we bridge this big gap? One way to bridge this gap is through clear conversations about goals, long-term goals and short-term goals. Instead of focusing only on pain scores, patients and clinicians can discuss daily activities, mobility, sleep quality, ability to work or socialize, and overall quality of life. When goals shift towards function and stability, progress becomes easier to measure. Small improvements can accumulate into meaningful changes over time. And patients thus may feel more engaged in their own treatment plans. Chronic pain care is challenging for everyone involved. Patients carry the daily burden of pain. Physicians work within evidence, safety standards, and regulatory oversight. Healthcare systems must balance access, cost, and risk. Understanding these realities does not eliminate frustration, but it can replace confusion with clarity and collaboration. Living with chronic pain, friends, requires persistence, but navigating treatment successfully also requires aligned expectations. When patients and clinicians share a realistic understanding of what treatment can achieve, care becomes more constructive, communication improves, and progress becomes possible. Before we close, I want to introduce the next topic in the series. We'll be discussing the risks and benefits of long-term opioid therapy, explained in plain language. Opioids remain one of the most debated treatments in chronic pain care. For some patients, they may provide benefit, while for others, the risks may outweigh their benefits. Understanding when they help, when they don't, and how clinicians evaluate their use is essential for both patients and healthcare providers. In the next video, we'll walk through that discussion clearly and objectively. Thank you for joining me on Pain Policy Practice, and we'll keep having these conversations clearly and honestly. Goodbye.